Hello, I'm Dr. Igor Simonov, and today I will explain you how I use the pulse diagnostic and PulseMap method for treating and diagnostic of patients with some difficult conditions. A few weeks ago, I had the first time female patient who came to the clinic with weakness. She was feeling very weak. She had the sore throat, despite her tonsils were removed when she was child. She has the previously a glandular fever. Also, this patient had the asthmatic cough, and she was receiving daily treatment with her puffs to prevent this cough. This patient also had some digestive condition. For example, she had the bloating, heartburn, constipation, which was changed with diarrhea, and sometimes this patient had the profuse sweating, the transpiration. Usually between the acupuncturists comes the question how we can treat this condition, how we can treat, for example, the asthma, how we can treat a glandular fever, or how we can treat the sore throat with this, in this strange case. So usually if we use the acupuncture pulse diagnostic, which is very different of the which we use herbal diagnostic used in the TCM mostly, and when we use the acupuncture pulse diagnostic, explain it in the book Nanjing of the 81 difficulties in Chinese medicine, we can find not exactly what condition patient has, but also the method of the treatment, how we can treat this particular patient. So here is the example of this patient with so many complaints. Again, I will remind that here we have the meridians of the design organs like the lung, heart, pancreas, spleen, liver, right kidney, and the left kidney. And here we have the four organs like the large intestine, small intestine, stomach, gallbladder, triple womb, sanjiao, and the urinary bladder. We can find that actually, as written in the book Nanjing, the lung meridian is very superficial, heart is deeper, spleen are better, pancreas is even deeper, liver even more deeper, and the deepest is the kidney. So despite so many complaints, this patient, her pulses, deepness of the pulses is exactly where it should be, except the right kidney, which shows the deficiency of the essential qi. Here we have the four organs, which also exactly where it should be. So what is happening with the patient who feel very sick, but her pulses are very well? So Nanjing explains that if patient feel very sick and pulses are fine, it means that patient actually healthy. But anyway, with this patient, we can see that pulse diagnostic shows how energy, how qi flows in the normal meridians, but it doesn't shows how does it flow in the muscular meridians or extraordinary meridians. Obviously, this patient has not any problem in her complaints not about any muscular meridian problems. So it is mostly can indicate that this patient has problem of her extraordinary meridian. So when we come to this extraordinary meridian, we possibly believe that this sore throat and the cough which this patient has, with the digestive problem. It's a problem of the Chung Mai extraordinary meridian. Actually, during the visit, patient remember it, which usually happen when the people come, for example, with the sore throat. They believe all the complaints or the history has nothing to do with the real moment. She remembered that she has actually hysterectomy a few years ago to the cervical cancer. So this condition explained that this patient has the problem of the Chung Mai extraordinary meridian. So after this meridian was opened, and also the Yin Wei Mai extraordinary meridian, like the complementary meridian, was opened, punctured, this patient started to have the severe cough, which late in few minutes was relieved. And few days later, when the patient came back to the clinic, she told that she feels very strong. She has not any more sore throat. She has not actually any cough. Her digestion has improved. She is still under the treatment, but it can explain that actually previous symptoms were treated like the symptoms and not like the one condition. So pulse diagnostic and the PulseMap method can show us exact condition which we need to treat and how we need to treat it. Of course, if we will look at the complaints of this patient, we can see that most of them, they actually explain it, and the treatment is explained also in the book Zhenzu Da Chen, the chapter about the treatment of Chung Mai extraordinary meridian. Thank you.